Picture this: the entire U.S. government frozen in place, with countless workers idling and essential services at risk. It's the ongoing shutdown drama that's got the nation on edge, and it's all boiling down to a heated debate over healthcare funding. As tensions mount, Senate Majority Leader John Thune has stepped forward with a proposal aimed at breaking the deadlock. In a recent MSNBC interview that aired Thursday morning, taped just the day before, he revealed to the public that he's extended an olive branch to Democrats. Thune offered them a straightforward opportunity: a dedicated vote on extending the Affordable Care Act's ACA premium subsidies. This, he believes, could tackle what Democrats see as their top concern, potentially paving the way to reopen the government. But here's where it gets controversial. Thune made it clear he couldn't promise a specific result from that vote. "I've been very upfront with them," Thune explained in the interview. "I've repeated that we're open to discussions. If they want to vote, we can set a firm date for it. Eventually, Democrats need to accept a positive step forward." His words highlight a key sticking point. While he's willing to facilitate the process, there's no assurance that the outcome will align with their wishes. For context, especially for those new to this topic, the ACA, often called Obamacare, is a major healthcare law designed to make insurance more affordable, particularly for those on lower incomes. Premium subsidies are like financial cushions that help cover the cost of health insurance plans, reducing what people pay out of pocket. Without them, many families could face skyrocketing bills, making it harder to afford care and potentially leading to more uninsured individuals. Democrats have been adamant about addressing this to prevent such a spike, which they argue would disproportionately hurt middle and working-class Americans. They've held firm on this demand even as the shutdown stretches into its 16th day, refusing to back funding measures without these fixes. It's a classic standoff. One side prioritizes immediate relief for healthcare access, while the other focuses on fiscal responsibility and long-term reforms. The Senate has repeatedly failed to move forward on the GOP's funding bill, with Wednesday marking the 9th unsuccessful attempt. Looking ahead, Thursday brings another pivotal vote, a short-term funding bill, but with a twist. Thune plans to introduce a procedural change, including a vote that would fully fund the Department of Defense for the entire year, ensuring military paychecks keep flowing without interruption. This isn't your typical shutdown-related vote. Instead, it's kicking off discussions on one of the 12 standard annual appropriations bills that normally keep government operations humming smoothly. If this proposal gains Senate support on Thursday, Thune intends to build on it by attaching funding for other agencies through the Senate's regular order process, a methodical, transparent way of handling budgets that allows for thorough debate and amendments. Unlike rushed, last-minute deals, it's like piecing together a puzzle step by step, ensuring every part fits before declaring it complete. Thune emphasized in the MSNBC chat that restarting government functions is essential before diving into deeper healthcare reforms. He's committed to ongoing talks, but again, no promises on results. "I see a potential pathway ahead," he said, "but it must involve meaningful changes to the system." Can I assure you it'll succeed? Absolutely not. That's what everyone wants, certainty that it'll pass. He reiterated, "What I can promise is a structured process and a fair vote." House Speaker Mike Johnson, weighing in on Thune's statements during a Thursday morning briefing, echoed the caution. "It's impossible for Leader Thune to lock in a definite healthcare result for Senate Minority Leader Chuck Schumer," Johnson noted. "We haven't wrapped up our internal discussions on that yet. It's just that straightforward." On a more collaborative note, Thune pointed out shared ground. Both parties seem eager to curb rising healthcare costs. Yet, he stressed that adjustments to the program are necessary, and those conversations can only kick off once the government is operational again. For beginners wondering why this matters, imagine a family budgeting for groceries and rent. Sudden premium increases could push them over the edge, leading to skipped doctor visits or medical debt. And this is the part most people miss: the shadow of rescissions looming over the negotiations. Thune fielded questions about the White House's efforts to cancel or rescind. previously approved congressional funds, a legal power presidents have under the Constitution, but one that sparked distrust. Democrats worry this could undermine funding agreements, making them hesitant to negotiate. While Thune didn't outright demand the White House halt rescissions, he favored sticking to the traditional appropriations route. Rescissions are within the president's authority, he acknowledged, but whether they exercise it is up for discussion with the administration. He mentioned chats with the White House and argued that a standard process benefits everyone, including the executive branch, by fostering buy-in and stability. As Thune gave this interview, the House was entering its third week of recess, a scheduling choice Thune described as a call by Speaker Johnson. "There's no urgent business right now," Thune said. "They've done their part by passing their bill. Now the action is squarely in the Senate." He also declined to predict when the shutdown might wrap up, expressing hope it wouldn't drag into Thanksgiving. When pressed by host Ali Vitali on a timeline, Thune replied, "I truly hope it doesn't extend that far, as it would cause significant hardship for everyday Americans." This standoff underscores a broader tension in U.S. politics, balancing immediate needs like healthcare affordability with concerns over government spending and program reforms. And here's where controversy bubbles up. Should Thune's offer of a vote suffice without guarantees, or are Democrats right to demand more concrete assurances? Is the shutdown a necessary pressure tactic for change, or is it unfairly harming vulnerable groups? What do you think? Do you side with Thune's approach of process over promises, or do Democrats have a point in pushing for guaranteed outcomes? Is there a controversial angle here, like whether rescissions are a fair tool in political negotiations? Share your opinions in the comments. Let's discuss. ABC News' Lauren Peller contributed to this report.